Hello everyone and welcome to Friendly Pharmacy 5. There are so many of you who have joined over the past week, and I just wanted to welcome you all and say how happy I am that you're here on the Friendly Pharmacy 5 channel. This channel will always look to provide you with the best evidence-based medicine. I will not give you science that is not based on evidence. And that's a commitment that I am making to you on this channel. Today, I have a very interesting interview about a certain mouthwash from Brazil that is showing a very high efficacy against the SARS-CoV-2 virus. So before we get to the interview, let's find out a little bit about our interviewee, Dr. Fabiano Vieira Vilhena. Dr. Fabiano Vieira Vilhena graduated from the University of Dentistry of Alfenas. He has a Master of Science in Public Health from the University of São Paulo. He has a PhD in Oral Biology, also from the University of São Paulo, and a postdoctorate from the University of São Paulo as well. He has over 24 years experience in public health, research, development, and innovation, involved in the development of Refix dental technology, and the development of Phtalox soft tissue regeneration, antimicrobial, and antiviral technology. Hello and welcome to Friendly Pharmacy 5. My name is Lindsay Dixon. I'm a pharmacist here from British Columbia, Canada. And today I have with me a very special guest, Dr. Fabiano Vieira Vilhena. Dr. Vilhena is joining us from Bauru, São Paulo, Brazil. And today he's going to be presenting on some very interesting research that he's been conducting with his team about the use of a certain mouthwash and its efficacy in possibly reducing viral load of COVID-19. So Dr. Vilhena, thank you so much for joining us today and for taking time out of your day to be with us.
It's a great pleasure to be here, Lindsay. Thank you very much for the opportunity to explain, our research, our technology. It's very important in these moments, in this pandemic moment.
Yes.
I have been working for 24 years in public health area. Focus on research, development, and innovation in health technologies. And it's very important to say that, of course, we will talk more about, in this interview, about Phlox technology or Phtalox technology. For us, it's very new name, so very new word. So sometimes we say one way, another other way, but I think the correct form is Phtalox, no?
Mm-hmm. Yes, and you have been doing research for quite a few years with the University of São Paulo, correct?
Yes, I did my postgraduate there.
Mm-hmm.
And each research in my master, my PhD, and my postdoc, I developed some technology. So all my studies are focused in developed technologies.
Okay, very interesting. And you have been to Canada to present some of your work before, is that right?
Sure. Last year in Vancouver, during the IADR Congress, it's a very important Congress, International Association of Dental Research, and we present the Refix technology there.
Okay, yes, Refix is another product that you've been involved in the development of, and we might be talking about that in future. It's very interesting as well.
Yeah. For dental regeneration and dentin hypersensitivity.
Yeah, it's very, very interesting. So we might have you on again to discuss that product, because that one's sounding very, very promising as well. So what has it been like, for you as a citizen? What has it been like to be in Brazil? I just have some stats on Brazil right now during the COVID-19 pandemic. So for those who don't know, Brazil has a population of about 212 million people.
And to date, they have had 6.34 million cases of COVID-19 and around 173,000 deaths, which is a lot of deaths. So the pandemic is not really showing any sign of slowing down in Brazil. What has this experience been like for you?
Lindsay, it's a big shame for all over the world. Here in Brazil is not different it's the same during all over the world. So we at the moment have another wave.
Yes, second wave.
Case comes up very quickly again. I think here is very complicated because sometimes I think people are tired to stay at home, to stay using masks. Other countries like Japan, China, and others, they are using masks is very common during the winter because they use these as a preventive measures to respiratory disease, during this moment. I remember when I'm in Austria, I saw lots of Japanese people using masks. It's not common for us,
No. Yeah, it's not in Canada either. It's been very challenging culturally.
So here is very complicated.
Yeah. Okay. And so can you tell us a little bit about your work and how you came to be involved in this study?
Sure. So my current study is about oral tissue regeneration area. As we talk a little bit about Refix technology is a dental regeneration, and another one is Phtalox technology, is a soft tissue regeneration, antimicrobial and anti-malodor technology.
So malodor is like a bad breath, right?
Bad breath, exactly.
Okay.
Exactly.
Yes.
And these research and these results, the antimicrobial and these actions, we will present, presented, but in a webinar during the IADR 2020, but not personally, online,
because of the pandemic.
Exactly. So we will present this year to the scientific community the Phtalox, but in another way. Since the pandemic happens, and our results, our finds discover that the Phtalox is a huge antimicrobial technology, we decide to test against SARS-CoV-2, and yes,
it's effective.
If effective, yes.
And so you started with laboratory in vitro trials, right?
Yes, we start the first laboratory test, and then we decide to involve 4 research centers, more than 60 research, and we did the validation. It's correct, this term, validation.
Yes.
In evidence-based science. That is very important to say, Lindsay. What we will talk today is have an evidence. Understand?
That's right.
It's very important. Very, very important.
So could you tell us a little bit about how Phtalox was developed and how it works?
Sure. So we start our studies in oral care, as I told, about focus on malodor, gingival health and healing. So, and then we discover this function to inactivate the SARS-CoV-2. So, and what is important? What is Phtalox, no? Phtalox is a innovative dye,
Innovative type.
okay, a type of innovative compound that was built based on Phtalocyanine technologies. So Phtalocyanine is very effective, have a good antiviral action, have an anti-inflammatory action, and anti-tumor as well. So
Wow.
very interesting. And lots of studies and lots of application, you can use this technology. But the difference that's Phthalox for the other ones is that Phthalox is a kind of a self-activation compound.
Okay.
We use the molecular oxygen inside the mouth to activate this compound. And since this compound is activated inside the mouth, this technology can inactivate the virus. So probably there is attraction between the compounds and the virus, electrostatic or something like that. There is some in silico studies that prove this information.
Okay.
We must do more studies, but the literature can show us this function.
Okay. And I think it's important that to note that this product is also not cytotoxic, right?
Yes. We did, when will explain more about these studies. We did 3 studies about this, and one of them is already available because these have an abstract in the side of IADR Congress. So we did one, and no cytotoxic was found about these compounds. No, but a low in some studies and another no cytotoxic.
That's excellent. Yeah. And so, could you tell us a little bit about the studies and what you've been finding?
Sure. The thing is, as I told you, we did evidence-based science. So we start with the in vitro studies, and then we come to case series, and finish with the most evidence, or the most important evidence is the clinical trials, no?
Yeah.
So we did, in 9 months, we did every part or every phase of the studies. Some studies are already published, and other are submitted, and other in the phase that we are finished some corrections, and in a few days we will publish everything about our finds.
Okay.
So, the first one, we use the in vitro study. No, we use 2 patients that are COVID-19 positive for PCR. And we collect some material from them and took to the laboratory and test. And in this first in vitro, the first one that confirmed the inactivation about, we found more than 98% of inactivation, the first one. And then we come to the case series. In this moment, we studied 14 people that are COVID-19 positive as well, PCR test. And then we evaluate the symptoms and the severity of the symptoms. Okay.
Yes.
One is very important to say that we discovered that 40% of the sample had mouth ulcers, and probably mouth ulcers is a symptom for COVID-19 as well.
Yeah, I didn't know that.
Yeah.
That's very interesting. I never knew that as a symptom. Yeah.
We found lots of information at the literature, and we confirmed this in our case series.
Okay.
And then wow, very important to say that in this case series, we found that a quickly recover for the symptoms, cough, throat,
Sore throat.
sore throat, yeah, and very quickly recover for the symptoms. 2 or 3 days becomes asymptomatic.
Wow.
Yes, we have this data in a preprint situation. 2 papers will be published in a few days, I think. And the most important is the clinical trials, no? Two
Yes.
clinical trials.
Mm-hmm. Mm-hmm.
One of them we use to validate in the Brazilian health regulation, no?
Yes.
Use one of these results, a report to Anvisa here in Brazil, and Anvisa approved for us to use this mouthwash as inactivate the SARS-CoV-2 inside the mouth, because
it's important that it's to know, so people know, and Visa would be like the FDA or Health Canada, and it is not easy to get that approval, right?
No, not easy, not easy. You must have all the studies, all the documents that are necessary to prove the efficacy, the security, the test for if the product is okay or not for the people to use. So it's very difficult to approve this. So in the clinical trials, we had 2. One focused on the viral load, and another one focused in the severity of the COVID-19 and the time of the length hospital stay. Correct?
Is that the length of hospital stay? Yes.
Length of hospital stay. Yes. So another study involved 91 individuals that participate in this study. 50 of them negative, so dropout. Okay. 41 that confirm PCR positive stay in the study, and 21 use a placebo mouthwash.
So just to clarify, these 41 people had been admitted to hospital. They were COVID-19 positive, verified by PCR. Yes. And then you split them and they were randomized, right?
Randomized, exactly. Okay. The 9 to 1 was randomized because if the patient comes to the hospital, the people receive the term to participate, and the kits. If they sign the term, okay, you receive the kits. But sometimes this patient is not COVID-19 positive.
Right.
Understands? The people have the symptoms, but not confirmed by PCR. So dropouts. Sure. Very important to say this. No? And another very important thing is not a high severity, because if the people are in a bad condition, go to the unity how can I say?
The intensive care unit?
Intensive care unit, ECU, no?
Yes.
It's just a moderate and
mild to moderate.
Yes.
Yeah. Mm-hmm.
Okay, so 21 receive the placebo, water, flavor, and color, nothing more.
Mm-hmm.
And another 20 receive the mouthwash with the Phtalox technology. Okay.
Yes. Mm-hmm.
But the computer presents a great surprise for us, no, when randomized,
Yes.
because the active ingredients group, the Phthalox group, had around 12 years older than exactly around 60, around 46, 47. So we imagine that the literature, no, you can find this. The literature shows that this group, the older group, probably will stay some days more.
Yes, in hospital. Yes.
Understand?
Yes.
So, and a great surprise, no? For placebo, 4 days. Sorry, for active group, 4 days, and placebo, 7 days.
Of hospitalization.
Hospitalization, yes.
Mm-hmm. And these people in the group with the mouthwash, they were using this mouthwash, was it 5 times a day for 1 minute each time?
The protocol was 5 times a day during 1 minute, 5 milliliters. Okay. Initiate the gargle and mouth and rinse. Gargle, rinse during 1 minute.
Mm-hmm.
Okay. And then 5 times a day. No?
For 4 days.
What? Sorry?
For 4 days, right?
No, 4 days that we take the information by the saliva, but they use the period that stay at the hospital.
Okay.
The mean is 4 days for the active group, and the mean was 7 for the group. But they use since they were there.
Mm-hmm.
And another very important thing, the results. The severity of COVID-19 for these patients, no?
Mm-hmm.
People that participate in the placebo, 1/3 go to ICU unit, no, yeah.
Yes.
And stay there, and half of them, sorry, no, but
unfortunately, passed away. Mm-hmm.
For the active group, anyone go to ICU and
no ICU admission. Mm-hmm.
And no death. So amazing results.
Mm-hmm. Mm-hmm.
I'll say that the treatment, the medicine that everyone take was the same.
Mm-hmm.
Antibiotic, anti-inflammatory for all the people, the same protocol.
Mm-hmm.
They only differ in the mouthwash protocol, but the medicine was the same.
Wow. Those are really good, really great results. Congratulations.
Thank you very much.
Wonderful results, because you could have already saved some lives with this product.
Yes,
right?
Yes. And of course, if someone asks me, oh, it's a preventive measure. Yes, it's a preventive because since we are prevent the severity, is a preventive as well. Understand?
Mm-hmm.
You prevent the progression of the disease inside the body.
Mm-hmm. Mm-hmm. And so now you are doing more studies now in larger populations. Is that right?
Yes, is that right? Since we discover inside the body some great results in people that already had the contact with the virus,
Yes.
Now we are trying to find some information for people that if the people use in a preventive way, in a
Yes.
preventive measure,
Yes.
we can find something. So we decide to distribute in a whole city, a small city here, around
Yes.
a
I
thousand.
think 1,300 people, right? It's
Exactly.
the city of Uru, I think. Yeah.
Yes, yes. And then we are evaluate this. Of course, uh, we, we, we wait to know contamination and progression,
Mm.
not spread the disease in this city, no?
Mm.
But we must wait for the results.
Very interesting. So, can you explain to us? So, this mouthwash, what you're seeing is that it's reducing the viral load in the oral cavity, right, in the mouth. But so we know that SARS-CoV-2 is a respiratory virus, and it can enter through the nose or the mouth. So, how do you think this product works? Does it affect the nasal pharynx area, or is it mainly just reducing the viral load in the oral cavity? How does that work?
Sure. It's a great question, Lindsay, because if you use only in a rinse form,
Okay.
you inactivate only inside the mouth. But our protocol is not only mouth. Since we do the gargling as well, we
Mhm.
produce some aerosol. So we protect the oropharynx, and
Mhm.
probably when you are gargling, you inhalate the
Yes.
aerosol
Inhale.
nail. So you can inactivate the nasopharynx as well. And sometimes you can, when you have some nose, block nose, I don't know,
Congestion.
some
Yes,
congestion,
congestion.
exactly. When you have some congestion, you can, when you use the gargling, it's amazing because suddenly, immediately, you
Immediately.
you discongestion, correct?
Decongest. Yeah.
Decongest. Yes,
Yeah.
yes.
Yeah, and just to so people realize, Dr. Vilhena, you use this product, don't you?
Yeah, sure,
How do
sure.
you use it? You said it's great for cutting through tartar and other things. Do you think that it's helpful for tissue regeneration as well? Do you think that's part of the efficacy? People with mouth ulcers, they're healing faster.
Yes, very great. We are receiving lots of new information.
Yes.
It's not a scientific information,
No,
but
I know.
friends, oh, doctor, it's a great pleasure to share this information to you. I had some inflammation in the throat, and I asked my doctor to make us a recipe for me to use antibiotic. And I used the mouthwash in gargling way, and suddenly it disappeared, the inflammation. So
Wow.
we are receiving lots of feedbacks.
Yeah.
And it's very important to say this.
Do you think that this could be used maybe as a maybe a nasal spray, or I know you're working on a gel, I think, for it as well.
We are under
Yeah.
investigation. No?
Yes.
Three other forms. Spray for
Yeah.
oral spray,
Okay.
and dentifrice with Phtalox technology.
Okay.
And another one, very interesting, in University of Londrina, in the state of Paraná. No?
Mhm.
We are testing the nasal spray containing the Phthalox technology as well.
Oh, you are. Oh, wow.
Yes, yes, yes. Another clinical trials, very interesting clinical trial that we divide in three groups. Uh, two technology, the mouthwash, placebo and active ingredient, and nasal spray, active and and placebo.
Oh, very interesting. Yeah. So it's
65 patients.
65. Yeah.
65.
Yeah. And so now you're expanding into all of these other areas of research. And I think you're testing this on, I think, at least over 2,300 people, maybe more at this point. Is that right?
Yes, yes.
In different settings.
We are in conduct, I think, more 10 studies involved 2,000, more than 2,100 people.
And you are testing this in healthcare workers as well, right?
Yes, healthcare to protect as a preventive measures, no?
Yeah.
The fourth, no?
Yeah.
Washing hands, use masks, social distancing, and use the gargling.
Yeah, and I'm glad you mentioned that, because we are not presenting this product today as something that is a substitute for those things. So we still, we need to be social distancing, using masks, all of these things. But it is interesting, and you pointed this out to me, that in some countries in the world, such as Japan, mouthwash is actually added to those measures, and they've been doing that since the beginning of this pandemic, and also in other pandemics like MERS and SARS. Is that right?
Yes, yes. There's a document. I think from health Minister of Health in Japan.
Yeah.
2005, 15 years ago, and when some situations like that happens, 4 measures: social distance, washing hands, use masks, and gargling with antiseptic compounds. No.
Yeah, yeah. And these countries have been very good at controlling their pandemic, not only for that reason, but it's very interesting that that's part of their pandemic plan and their public health communication, right?
Sure. For me,
yeah.
Vietnam for me is a huge example for us. No.
Yes.
Very.
Vietnam is living another reality right now. Yeah.
No, totally.
Yeah, yeah. Wow, that's very interesting. So I have had some questions from some of my viewers about other mouthwashes. So we can't get this mouthwash yet here in Canada or in other places around the world. So what are your thoughts on using a regular mouthwash, or like we have a prescription mouthwash here called Peridex, chlorhexidine, and even iodine? What are your thoughts on these? I know this was not your study, but as someone who is in this, who is an expert, who is a dentist and very well qualified, what are your thoughts on someone using this in addition to all of the other measures?
So I'm not aware about all the studies, about all the technology, or about all mouthwash, but some studies had proved that have some inactivate action for SARS-CoV-2 in vitro, no?
Yes.
In vitro. So it's a big shame, because some of them not confirm in vivo.
Most of them, I've had a hard time. Even this last week, there's a product here, I don't know if you're familiar with it, called Listerine Cool Mint, and they're talking about in vitro, but it's hard to find anything in vivo, like you said.
Yes,
yeah.
Yes. I saw 2 studies, one about chlorhexidine.
Chlorhexidine, yeah.
And another one was hydrogen peroxide.
Yes, yeah.
Not confirmed in vivo, both.
So what do you think about people? I thought that hydrogen peroxide wouldn't not be the best thing for healthy tissue. What is your thought on that?
It's not a pleasure to use these, no. And I think it's a little bit toxic for the organs, no.
Yeah, I thought that it could be somewhat toxic, and it could possibly damage healthy tissue.
Sure.
Yeah.
In dentistry, it's very common, not now, but when I did my graduation, 25 years ago, we don't have lots of medicines or a lot of technologies, and we use these before some intervention, but now it's not good.
You know anything about iodine?
Iodine, I had some information from Japan as well, no?
Yeah.
They conduct another study there, very similar to our study here, and they found some evidence there. I think iodine in some way makes some difference, no? But of course, it's not good to use this as a gargle. It seems that's
Would
very
taste good.
dirty, something like
Yeah.
I
Yeah.
because it's common to use it to in the
On the
superficial.
skin.
Yes,
Yes. As an
yes.
antiseptic. Yeah. I can't imagine putting that in my mouth, to be honest. I don't know. I don't think so. It's interesting you've been able to create a product that is palatable. People are able to tolerate it. You evaluated that. People filled out questionnaires, and so it's tolerated and no side effects that you're aware of.
Nothing, nothing. We did the survey, we did, and we confirm very sweet, pleasant taste, very good. To made a rinse, to made gargling, nothing happened, no side effects. So it's totally approved to use daily, daily, daily. No, no side effect.
Okay. Yeah, no, that's excellent. And so what do we do now? Oh, and one other question I want to ask you is, because you know all about, so the regular flora, the bacteria and the balance of bacteria that we have in the mouth is very important to our health. And so do you have any concerns with this or other regular mouth possibly disrupting that flora or causing any other ill effects if this was used, say, daily?
Yes, we evaluate in this survey as well, no? And nothing was reported, nothing, nothing. No side effects, no burn, nothing, nothing. Very, very good.
How long have you been using it for?
Me?
Yeah.
Oh, more than me.
A year. Wow. Okay. Well, that's good. This means a lot. Yeah.
When we start the research about the Phtalox, of course, we are involved, to use. And
Yes.
we start the studies about during these 9 months to confirm the inactivation, in the virus. Oh, every day I use every day.
And it's fine. You don't mind it.
No,
Yeah.
at least twice a day.
And you.
Sometimes twice, sometimes three, but every day.
Okay. And so what further studies are required and how can we get this product to the world, or are you just going to keep it for yourselves in Brazil?
It's very interesting because we start to distribute, to become available in the market last week. And there's some sites that receive first. For example, Londrina City, in the north of Paraná State. And of course, we will look the results, the epidemiological results. No, probably we can find something. But the next studies, as I told, is about another claim. No, another claim. If you really prove that, how can I say, less spreads and less contamination. It's correct.
So it reduces the spread of disease and transmission. So that's what you're trying to look at that now.
Exactly. Because we already know in a series of cases that reduce the spreads. Otherwise, me and another research, of course, will have contact with the SARS-CoV. Oh, another important thing, Lindsay, it's very important to say that all the research we have, not all, but our group are very involved with this in a task force here involved all over the world to find some difference, no, to reproduce it all over the world. So we are in the virus with our hands. You are in contact with the patients that are contaminated. And
Yes.
we are using this, understand? And
Okay.
it's very important to say this, no? And you asked me about to available, no, the technology all over the world.
Yes. Can we buy this on Amazon? How do we get it?
Yes, I'm on Amazon, exactly. But the thing is, Brazil is a big country, you know,
Yes.
and the company, of course, that had the technology at this moment uh, wants to first distribute here in Brazil. And a great strategy is to license the technology, the formula
Right.
for other industries for all over the world. Because first, the cost you'll be less for to license the formula and more quickly as well, no?
Yes.
Because we produce this in each country, in each locals to achieve this site or these people that are in production. So it's important to say this.
Okay. So we might not get it for a little while unless someone in Canada is interested in license and production. So one other question I had for you is, do you think that, and I know this is not your study, but does it make you wonder if this product will be active against other viruses and other, used clinically for other things?
I have an answer for this.
Okay.
Yeah. It's a preliminary answer, but I have an answer. We already test in vitro against H1N1.
Oh, wow.
Yes, and inactivate as well.
Really? What do you know what percentage?
We are under develop this under these studies are is not finished yet.
Okay. Okay.
Preliminary results that we found, yes, inactivate the influenza virus.
Wow. And I also think it's important to note that you are, you did this study and you were able to do it in vivo, but you are also encouraging other scientists around the world to also test this product for its validity. And I'll read what you guys have put out. You've said, we urge scientists and governments to join us and develop other clinical trials to evaluate the effects of Phtalox mouthwash protocol in decreasing the SARS-CoV-2 viral load, preventing the spread of the virus, and the severity of COVID-19. And I think that's very important.
Sure. Very, very important. Thank you very much to read this final paragraph of our short communication. It's very, very important, Lindsay. We are here. We have already 60 research, but want to have another research with us all over. We can send the technology. We can reproduce the studies because we are sure that we can make the difference.
And ultimately, this could save lives.
Sure.
And this is such a significant contribution to the pandemic, and we all can do something, right? So,
I'm the coordinator of all the studies, and since we received the first result about placebo that we lost some patients, in my opinion, it's not necessary. Of course, probably all the validate is necessary, and probably all the placebos are necessary, but for me, it's very difficult.
Yeah. And this product is being distributed in hospitals now too in Brazil, right? It is.
Yes, we I think next week we will make a donation for a hospital that conduct the study to every healthcare receive this and use to protect our life, not only their lives, no?
Yes, yes. Well, it's very significant. Well, thank you so much for your time today. Congratulations on your work. Like we said, there are not very many or any in vivo studies yet that we've seen that are, you know, of this caliber. So congratulations. And I would love for you to come back once you have more epidemiologic data on, you know, different, you know, settings that where you're testing this. It'd be really nice to stay updated, and you know, I wish you all the best. This is really interesting, very innovative, and what a great measure for public health during this very difficult time.
Thank you all. Thank you very much. Thanks a lot. Pleasure to discuss some scientific points. All our research was developed in evidence-based science.
Yes.
Had we did all the steps. We registered the results. We are involved. So thank you very much to disseminate this idea.
Yeah, likewise. Well, and we look forward to hearing more, and maybe eventually we'll see this innovative product in different places in the world. Thank you so much, Doctor. Appreciate your time. Take care and stay healthy there in Brazil.
Okay, thank you very much.
The best. Take care. Bye-bye.
Bye-bye.